I'm Alexis Hebert, and my new knowledge video is about how I could have implemented Expert. There was an experience that I had with a patient where I could have used screening, brief intervention, and referral to treatment, or Expert, to discuss a patient's smoking habits with her and possibly make a difference in her cigarette use. Unfortunately, at the time, I was unaware of the Expert techniques. In my fundamentals clinical during junior year, I was taking care of a diabetic patient who was hospitalized and had a recent amputation of her big toe. She had poor health habits and was not taking good care of herself. One of those poor health habits that she engaged in regularly was smoking cigarettes. She even made remarks several times during the clinical day about how she wished she could smoke in the hospital or how she really wanted a cigarette. I remember telling her the usual medical advice that comes from a healthcare provider. You know that smoking is not good for your health, especially with your diabetes. I thought about it, and I knew that she likely wasn't going to listen to my advice because she probably heard it a million times already and still continues to smoke. I wasn't sure what else I could say other than list all the bad things that smoking does to the body. I knew that this wouldn't be an effective method, so I sort of let it go after telling her that it wasn't good for her. If I got the chance to do over this situation today, what would I do differently? Thanks to the Expert training that we experienced this semester, I learned motivational interviewing techniques that I could implement into the situation. I learned that the motivational interviewing process begins with engaging the patient and establishing a helpful connection. I did have a good connection with this patient, so I had a good opportunity to use Expert. The next step is focusing on developing and maintaining direction about change throughout the conversation. While doing so, evoking the patient's own interest in change and inherent motivations to change occurs. Lastly, developing the commitment to change leads to ending your interaction with the patient by formulating a plan of action and, if possible, a time to follow up with them. The methods of motivational interviewing included an acronym called OARS. O stands for open-ended questions. If I'm asking yes or no questions that allow the patient to give one-word answers, they likely will not elaborate off of those yeses or nos, which makes it difficult to follow up. In my practice with this patient, I would ask open-ended questions such as, when did you begin smoking? Or, what is it about smoking that you like or dislike, to get a better picture of her situation. A stands for affirming. It is important to shine a light on the things that the patient has done well or good character traits that they may have. In my practice with this patient, I would say something such as, it's nice talking with you. You have a great personality and a friendly attitude. This will help the patient's self-reflection, showing that even though we are talking about a bad habit that she has, I'm also recognizing good qualities that she has as well. R stands for reflecting. It can be a simple or complex reflection, for example, on the patient's behavior, affect, or something that they said. In my practice with this patient, I would say, it seems to me that you really want to smoke a cigarette and have a hard time going without them. This may lead to the patient saying something like, well, it's not that I want to smoke the cigarette, which can then help direct the conversation toward change. S stands for summarize. In my practice, I would summarize the conversation that the patient and I had about her cigarette smoking, using phrases such as, what I hear you saying is, and, so the plan for you is, to help recognize her change talk and form a clear picture of what her next steps will be. Other helpful parts of the Expert training included using the readiness to change ruler. For example, I would ask this patient, how willing are you on a 0 to 10 scale to decrease how often you smoke? And then following up with, well, why not a lower number? To elicit change talk. There were many other helpful techniques and interviewing methods included in the Expert training and in the handouts we were given to use as a resource. Using Expert is a great way to help someone decrease or stop an unhealthy behavior, such as smoking cigarettes. It is evidence-based practice, and there is plenty of literature to support its use. A study was conducted using a sample of 17,575 patients to further explore the changes that would take place in regard to substance use behaviors of patients who received services as part of the Expert program. These researchers compared pre-Expert substance use with substance use 6 months after receipt of Expert services. Results showed that from pre to post Expert, there were statistically significant decreases for nearly every measure of substance use, including alcohol and drug use. I'm glad I now have Expert as a tool and resource that I can use in my practice going forward.